Welcome to Dr. G at the Heart of Healthcare. It's season 2, and we are having a blast. I finally have the privilege of talking to hospice nurse Penny, the Tik Tok queen over here. She's up there off the grid in Washington. I'm a little excited and nervous about that. Like, are you a CIA agent, really? Anyway, I'm joking. So, welcome to the podcast, Penny.
Thank you for having me.
You look fabulous. It's so good to see you again. We'll get into your bio, but I'll just let everyone know. Penny was like telling me about TikTok because I tried to honor her for Nurses Week, and she's like, "You don't have 1,000 followers." I was like, "Oh, I didn't know they were like that." So anyway, I have 1,000 now. You'll be proud of me. I'm not trying to be like you, but I just want to put the education out there. So anyway, tell us a little bit about yourself. I know you have 2 decades of experience in hospice, and you're doing the quality now, but give us like the 30-second bio of Penny Smith.
So I actually am an old nurse. I went to nursing school when I was 40, and I knew when I became a nurse that I wanted to go into hospice. So I worked for 1 year in a clinic, a family practice clinic. I started as an LPN, and I thought you had to be an RN to work in hospice. You don't. So if you're an LPN and you want to work in hospice, know that you can.
Yeah.
So I started in a clinic with the plan of becoming an RN to work in hospice. I worked there for a year and then decided I wanted to move into a hospital to get more skills. Went into a hospital, into med surge for about 3 months, and then was laid off. They lay off LPNs cyclically in hospitals about every 10 years. So I was laid off. At that time, I noticed that there was a brand new hospice care center being built in my neighborhood. So I thought, well, you know what? I'm going to go and just see if they're hiring LPNs. And they were. So I started there. I worked there for many years while I got my RN. Did a little brief stint in the emergency room for about 3 months. Hated it.
It's
Very
chaos
different.
in there. It's
Very
chaos.
different from hospice. Just the culture of do everything for everybody was hard to watch and to be a part of. So then went to another hospice inpatient care center. I always say that experience is like in your face, at the bedside, death and dying. So I really had an opportunity to hone my hospice nursing skills by being in that environment, which I really loved. And then I was recruited by a large agency and did home hospice case management for several years, and then got sick of the drive in Seattle. The commute is really hard, and heard about this quality position opening up that's virtual. And so I thought, yeah, okay, I'm gonna go for that. And with the pandemic, it became completely virtual. And now I work part-time 3 days a week as a hospice quality nurse. I just stepped down from a hospice quality manager role. And now I'm just a hospice quality nurse. And I work 3 days a week from my cabin in the mountains. And I love it.
Oh, you deserve it. Bravo, bravo. Because we need the quality, right? I heard that, with our staffing crisis, a lot of new nurses coming in, and so they need to learn from an OG. So I'm not going to let
Yeah,
you call yourself.
and it's a Medicare regulation. I mean, the
Yeah.
cooperative program is required by Medicare. They're very, very big on quality for hospice patients. So it is really an important thing that we do.
Absolutely, absolutely. We want to stay compliant to Medicare.
Yeah.
So first of all, I have to go back and correct you. I don't call you old. I went to med school. 40 is not old. I went to med school when I was 37. So I think that's why I like you so much. We have that in common, like, switching careers, and you're like grown. So, you have a way about the way that you teach that's, I can't put it in a box. It's like in your face, but it's sarcastic, but it's like this. It's just, it's real. It's real.
It's
It's
real. Yeah.
real.
Keeping it
It's real.
real.
And that's what I appreciate. I can totally remember, I had a patient when I was with a large agency up in Northern California, and these people were like frequent flyers, this family, how we have those. And the person who had the power to put that patient on hospice saw one of your videos and they were like, yeah, I saw this lady and blah blah blah. She acted the whole thing out, and for me it's a little touchy. Like, everyone has their lane, everyone has their vibe, but some of the videos I'm just, it's not. But for you are reaching people that would never hear the message, like about, hospice is a wonderful healthcare benefit for people at the end of life. They would never listen, and they would get on hospice the last 6 minutes of their life. And we hate that, right?
Yeah.
So I just want to say bravo to you for all the work that you do, because so many people are getting the healthcare they deserve at the end of life and dying with dignity because of you.
Thank
So I
you.
had to give you that shout out. So yeah, so let's jump into the story. So I met hospice nurse Penny at Endwell. She came over here, down here to California and LA, and we didn't get to talk that much because there were so many people and it was so overwhelming. Like, it's like, ooh, who's that's such and such, that's such and such. It's just like, I don't know, if you really get to talk to people there, because it's just so exciting to have everyone there. There's each what I was struck by is everyone has their own mission and they're making a difference in their own lane. Like, and so we had a minute together at the hospice. What was it? We were doing the hospice table talk or something like that. But anyway,
Yes. Yeah.
yeah, yeah. So did you enjoy LA when you were down here?
Yeah, I loved it. It was really fun. I've gone down there a couple times and I've had a great time meeting up with people that I know through social media was really fun. So yeah, it was really great.
Oh yeah, you were hospice nurse Julie, and you two are
Mhm.
just peas in the pod. The first time I saw you both, you were live, and I was like, "Who are these girls?" Like, I didn't know what was going on. I think it
We're
was on
very,
Instagram a long time ago, but it was like total girlfriend. It was fun, and
yeah,
so then I
we are
noticed.
girlfriends. Like in real life, we met through TikTok. We
Oh,
became close through raising some money for a memorial service for a 25-year-old
oh,
woman who was dying of cancer, and she was on TikTok. She had a TikTok page, and so we did a bunch of fundraising for her, and then we went to the memorial. So Julie flew up. It was in Spokane,
oh
and
my
we that's where
gosh!
we met for the first time, and we talk almost every single day. We are besties. We talk all the time. So, and people always think I'm her, which is funny to me because she's literally young enough to be my daughter. And so it's flattering when people are like, "Oh, you're Julie. Oh, you're not Julie." No.
Okay, that's just weird. I mean, you're over here with the pink hair. You're like punk rock. I mean, come on now. Come on
You
now.
know.
That's weird. So what year did that happen? I didn't know about the girl who passed away.
That was in 2022, I think. Yeah.
Okay.
I think it was,
Okay.
well, no. So yeah, 2022. Julie and I met on, so I got on TikTok in 2020. Julie got on in 2021. She like immediately reached out to me as soon as she got on TikTok, and we started talking all the time. And then in 2022 um, was when Amanda, her name was Amanda, was dying, and we kind of got close to her through TikTok, and I went and met her in person, and she had a 6-year-old daughter, and her mom was really wanting to put on a nice memorial service for her. So we started a GoFundMe and raised $10,000 for her. So that was really cool.
That's good. I don't know if you want to speak to this point. We are death workers. We do the work. But sometimes those are the hard ones. When I see anyone that's their year is younger than mine, 1975, I'm like, oh, like it hits.
Mhm.
What do you think about those, or how in your
Yeah.
everyday work
I mean,
or
I've taken care of patients my age at every age I've ever been since I started doing hospice, and it always impacts me. And the ages of my children, caring for somebody who's the same age as your child, same thing. It is really impactful. And to do the work, you really have to have strong emotional boundaries, and you have to recognize that you didn't cause their death. You're not going to cause it to happen faster. You're there to do a job to support the family, to make sure that they have a comfortable death, and not take your work home from you with you. And it's really sad, but it's also a gift to be able to walk alongside of people when they're making that journey at whatever age they are. But yeah, I've taken care of some very young people, and it's sad for sure, but I'm happy to be able to help them.
Yeah, yeah, I agree. And, it helps us face our own mortality, and then live,
Yes.
and then do things like this. I really have seen a couple of your recent videos where you're like really nailing in the education about, morphine and eating and all those things. And I'm like, oh my gosh, like if people can only pay attention for 10 seconds before their anxiety takes over and they're not
Mm.
listening, they get it. And so that's why, this is so valuable. So since we're here, tell me just how you feel about your journey, and how you've seen things change, because obviously you have an impact on a lot of folks. I'm sure people have shared stories with you of how things went better because of you. Um, I want to hear if you have anything to get us doctors together, well, non-hospice doctors together, so we can really get this healthcare system together and people normalize hospice. Like, so I just want to let you loose and just let's, you know, go for it.
So I've always been a passionate advocate for hospice, for a good end of life care. Ever since I started doing it, I had death anxiety when I was younger, terribly. When I was in my 30s, it was awful. It was crippling. Working in hospice really helped me to come to acceptance that we are all going to die, and when we accept that, we will have a better death and we will have a better life. Um, Perseverating on future death is no way to live. It really impedes your ability to enjoy the moment, to be in the moment, if you're always stressing about what's going to happen in the future, which is inevitable. We can't control it. It's going to happen. Um, so I've always been passionate about educating about end of life care and hospice. And going on to TikTok gave me a different platform to be able to do that. And I knew within my, before I did that, my whole kind of world was with my patients who had already been told they're dying, they're on hospice. I'm just educating people who are already here in this. They're going through this, they're living this. But going on to TikTok broadened that for me. Now I'm educating people who are not on hospice yet. They're not facing their mortality. They do have death anxiety, or they're just now starting to get that diagnosis for their loved one or for themselves, and needing to know more information like before they're on hospice. And so I felt like, wow, this is really valuable information to bring to people. And when I started, it seemed to be there were a lot more people who were in the hospice murders their patients by starving them to death. They give them morphine until they die. Like I heard a lot more of that when I first started than I do now. So I feel like between me, Julie, and other hospice nurses that are on social media, the message is starting to get out there more, and people are understanding more about what hospice really is. That we don't hasten death, nor do we prolong life.
First of all, I love how you keep saying these terms, death anxiety, because we need to name it. My first podcast was hospice is not a bad H word. And it's kind of playing on the other words that we're not allowed to say in our society, you know what I mean? And then the C word and the M word, morphine, cancer, and all that stuff. And so it's from that fear, right? People immediately get scared. When we're in the store, when we say what we do, people are like, oh, I've had someone burst into tears in front of me. So saying the term death anxiety, I think that's great how that's literally what you're doing. You're destroying it and you're dispelling those myths and those misconceptions. It's unfortunate that people thought or think that hospice makes people die sooner, because that's telling me they don't know that person is dying.
Yeah.
right? Like they don't know that the prognosis is limited. And they think that when someone relaxes and they can let go of their body, they think that that's killing them. They would rather choose, let's call 911, let's get an ambulance, let's do all this stuff. And then the people in the ICU say, oh, we tried everything we can. Like, why is that more comfortable? That's actually traumatic and awful for a family. So I don't know
Mhm.
if you want to touch on that a little bit
Well,
more.
I also, so death anxiety, back to death anxiety is something that I knew that I had, um, but I didn't know how common it was. Like I had no idea how many people also suffer from the same thing. So that was something I learned through doing social media. But as far as people going into the ICU, I always say it's harder to make a decision to stop those life prolonging interventions once they're started than to just say no and not start them in the first place. Because when somebody has, something that requires them to be on a feeding tube, and you can either say no feeding tube, we're going to choose hospice and allow natural death, or let's put in a feeding tube. When you then put that feeding tube in and you start feeding that person, you get further away from the event that caused that in the first place. And so now when you're pulling that feeding tube, it's not that event that caused their death, it's you because you stopped the feeding. Like you've been keeping them alive by giving them tube
Ooh,
feeding. And so
that's it. That's a tough pill to swallow. You're saying it. Go ahead, Penny.
yeah, I just think it's easier to say, no, they died because they had a stroke and they can't eat anymore. And we didn't put in a feeding tube. Then they had a stroke, we put in a feeding tube. 3 or 4 weeks later, we realized they're not getting better. Let's pull the feeding tube. And now they're starving to death. So,
I told you guys she tells it like it is. Even I'm cringing. And I am a hospice physician. I
but
guess,
it's true. Don't you think that's true?
yes, I know it's true. I know it's true, but I guess we don't hear truth out here. We don't, the truth is not there. And I'm feeling the feelings for the people who don't get the truth. Even though I want to get it out there,
Mhm.
it's like, I don't know. I'm here for what you're doing. Thank you for telling it like it is. And I hope that people continue to overcome their death anxiety and understand the truth. What you're talking about is advanced care planning. It's
Mhm.
making choices along the way so that we don't get to that awful thing that you and I know. While you were saying that, so many things ran through my mind, where the after the code looks like a crime scene. And it's
Mhm.
like, they were dying. So I think that's the main point. People don't know that the person is dying, and that's where the problem is.
Yes.
So that goes to having conversations upstream with your primary care
Yes.
doctor, with the specialist, to know the trajectory of the disease. I have to write a statement. Such and such has a prognosis of 6 months or less if the terminal condition runs its course. You should have known that before I had to write the paragraph, right?
Right. Right. 100%. But, to be fair, and you know this because you're a doctor, in medical school, physicians are trained to save people, to do preventative care and to do curative care. There's not a whole lot of emphasis on death care, end of life care. And so death is seen as a failure. So nobody wants to go there. They don't want to talk about it. My dad was in the hospital with idiopathic pulmonary fibrosis. He did everything to try to treat it against me saying, I don't think you should do this. He went on steroids, he did chemo, he totally, exhausted his immune system and got pneumocystis carini. But before they determined that he had that, they think it's this. And so they're treating this. And I'm like, wow, my dad's not doing very well. I'm a hospice nurse. Can you level with me? How are things going? Oh, it's fine. We're going to treat it. It's fine. Then he gets pneumocystis carini. I do a little research. I find out that when people have pneumocystis carini as a result of a failed immune system versus AIDS, they have a 50% survival rate. It's very low. So again, I'm going to the doctor saying, hey, I'm a hospice nurse. I've been doing this for 5 years at that point. Like, this isn't looking good. What's going on? No, he's fine. My dad ended up on a BiPAP in the hospital in the ICU. On the day that he died, his pulmonologist finally said, I think we need to get a hospice consult, because if this happens again, he's going to be intubated. And I don't think he wants that. And I asked my dad, what's your code status? And he said, what do you mean? And I said, well, do you want CPR if your heart stops? No, I don't want that. No one had talked to him about that. He was on hospice for 12 hours and then he died. And I am a hospice nurse. I was advocating for this for him. Like, and they were all, no, it's fine. He's going to be fine. Nobody could see. It's like the blinders are on. They don't consider, like, there's this pathway, he's going to be fine, we're treating him, or it's possible there's this pathway and he's going to die, and let's look at both, which is why I love palliative care. And palliative care is definitely starting to be more common and prevalent. Back then, there was no palliative care program in the hospital. It was ICU, do everything, or hospice, allow natural death. There was no bridge in between.
Oh, that sounds so painful, but I'm sure that story drives you. Thank you for sharing that with us. You know, there's a bunch of stories out here, guys. These stories that are that drive us to change things. And back to medical school. That's what I can thank my medical school for introducing palliative care. First year of medical school, Texas A&M, and that's what got me on the path to where I am. And choosing hospice right out of med school. Right out of residency, because I saw the great need for end of life care. But I have this article here from Gemma I'm going to attach to the show notes. It's about having the conversation, and that's what it's about, right? So people should know, again, that they're dying. They should know what the trajectory of the disease is. They should know their code status before someone else has to decide to take things away. And so that's why we're here, guys. That's why we do what we do, so we can try to help you. And we've already seen some changes in medical education where they have to teach about, palliative care and things of that nature. Because if you think about it, we just passed July 1st, while we're recording this. The day you start residency, you have to ask people that stuff. So what if you've never talked about it? So it should be a part of the orientation, right? And I know that I just learned that nursing education didn't have death care in there, but again, it's changing. So I think we have people like you to thank for that. Where do you see things going with your social media presence? Anything you could share? Any surprises up your sleeve?
Well, I have written a book. It's going to be coming out probably next spring. It's a memoir, so it's actually it's a little bit of education about hospice and death and dying. It's stories about hospice. It's also about my life and my journey from how I started out life kind of recklessly and turned it around and became a hospice nurse. How I overcame my death anxiety through, the acceptance and the importance of living and not worrying about dying, because it's going to happen whether you worry about it or not. I also do a podcast with a hospice social worker called Death Happens, An Insider's Guide to Dying. We are actually working on a book together as well. And that's more of a, really all about hospice care and just kind of giving people the lowdown from getting that, awful diagnosis to what hospice is like and what you can expect at end of life. I've got a couple of keynote speeches I'm doing. I just kind of, I don't really have, I never planned when I started doing this to be a social media influencer. It was not on my bingo card, not even close. I had zero insight about this. I had no idea this was going to happen. So I kind of just let it take me where it takes me, and just follow the opportunities that come up.
Well, I think that's great. It shows that it's needed, with the way that the pandemic hit our society, well, our world, and then social media, it was kind of a perfect storm for decentralizing information, and so people can get this stuff right at their fingertips. You know what I mean?
Let me just say this about that. So what I say a lot when I'm speaking in public is, nobody wanted to talk about death, and then all of a sudden, because of the pandemic, it was in our face every day. Like, we're hearing about people dying everywhere. We're hearing about refrigerator trucks parked outside of hospitals because there's no room in the morgue. And so all of a sudden, people are hearing about death and dying constantly. And then a lot of questions come up like, whoa, like, what is this about? What is it? How do they die? What does it look like when they die? What are they going through? And so that, along with, now we're in lockdown and we're bored and we have TikTok. Like, this is where, yeah, like you say, the perfect storm. Like, this is where people went to find answers. And so
Yeah.
that is really how I got started in this in the first place, was because people wanted answers, and I had those answers for them.
Yeah, and I think you're affecting a whole generation. We're really changing things again. I remember a post that Duck Deck Lisa Paul put up about why didn't the doctor tell me about hospice sooner? We feel that.
Oh yeah.
We feel that you went through that.
Yes.
We see it all the time. When I have to write the CTI, and I read their records about the past 2 years of their life, and it's just like, are you kidding me?
Yeah.
Ooh.
Yeah.
Anyway, so we don't have to wait. You don't have to wait for anybody to tell you, because Penny told you when you were going through TikTok. Nurse Hospice Nurse Julie told you. I told you in the Real Deal About Hospice book. So and you don't have to wait for anybody to tell you, and then you end up, with an AIDS defining disease because of your immune system is gone. Like, when you are diagnosed with, you know, pulmonary fibrosis, end stage renal disease, congestive heart failure. Of course, there are things that we can do to treat. We can take a 70-pound, 90-year-old woman with Alzheimer's disease to the ER, and we can do a urine analysis, and probably there'll be bacteria. We can treat with antibiotics, we can give some IV fluids and send you back home. In the meantime, that person got deconditioned, right? Or we can send them to rehab, which again, then no bad talk about nursing homes here, because I actually just did a podcast about there. But I'm saying it's about making the best decision for your person. You can't blame what happened when they get there. And I need to stay gentle, because I want to be sensitive to people who have situations like this. You have to make decisions early so that your person or you have a better trajectory, because things happen. Many patients are a fall away from everything changing.
Oh
And
yeah.
so when you see things slowing down, have a talk with someone. Reach out to Hospice Nurse Penny. I don't know if you have time to check your DMs because you're so busy. Reach out to me, reach out to someone, and have the conversations. That's what I want you to take from this. Have the conversations in your families, with your primary care doctor, with your specialist. You be in charge of the conversation, because it's your health and your body, and your insurance pays for this. So anyway,
Right.
I don't know if you have any closing words, because I get kind of excited.
I do try to answer my DMs, and I did just get a question from somebody. Actually, I think I was doing question and answer thing on Instagram, and they said, my mother is 93 years old and she's been having multiple falls. Is she ready for hospice? And I said, okay, so falls by themselves don't mean she's ready for hospice, but they do indicate a change of condition. So there are other factors that weigh into this, like, is she having more frequent infections? Is she ending up in the ER? Is she being hospitalized? Is she losing weight? Do her clothes not fit? Is she having trouble swallowing? There are lots of things that can indicate that she's close to the end of her life. But at the bottom line is, if you're unsure, then call hospice, because hospice can assess and determine if they think that she meets the eligibility. But yeah, falling is, when people start falling, we know that's the beginning of the end.
Yeah,
And
yeah,
what you
and
were
I would.
saying about the patients coming on and dying right away, like, the average length of stay is around 80 days, and hospice requires a life expectancy of 6 months or less. So what does that tell you? Like, the average length of stay is minimal. So people do come on at the last. And how often do we hear people say, dang, I wish I would have known about hospice sooner? all the
Yeah.
time. They say it all the time.
Yeah, and we don't always have time to do everything we can do when it's just 12 hours. And I like to highlight the figure from NHPCO about the median length of stay because um, it's half or under and half or above that number. It was 18, now it's 17. 17 days,
Wow.
the median. So
Wow.
half of the hospice beneficiaries are
Are
below
dying.
17
Wow,
days, and that's ridiculous.
yeah. And then the above could be anywhere between 17 days and 6
Yeah,
months, right? And,
right.
people will say, "Oh, a hospice, like my so and so, it doesn't necessarily mean they're dying. So and so lived for a year on hospice, or look at Jimmy Carter, right?" And I'm like, yes, look at Jimmy Carter. Isn't that wonderful? He's been able to benefit from hospice now for a year and a half, I think it's been. And wow, that's awesome. We want people to realize that, yeah, it's a life expectancy of 6 months or less, but they don't get kicked off at 6 months. They can stay on longer. And hospice has been known to improve life to the point where people can actually live longer on hospice than they would if they didn't have hospice. So,
Absolutely. And so I am, waiting, to hear news about him. I'm excited about the Hospice Care Act that's, being drafted right now. And so we have some good things happening. So congrats to all your success, 2 books coming, podcasts, and all this stuff. It may not have been on your bingo card, but it's definitely needed. And so I'm glad I had a chance to talk to you and learn more about you. And we'll just sign out on this episode of Dr. G at the Heart of Healthcare. Thanks, Hospice Nurse Penny. Peace.
thank you.
That was good. I don't want to go too long. It's like, 30 minutes. I like to keep it short. No, but that was
I
so
could go on for days.
good. No, we could.